Some of the newest advances in spinal fracture treatment consist of performing cement augmentation or kyphoplasty of that fracture that avoids the open fusion of the fracture and requires just a small skin incision where we were able to place cement into the compression fracture and fix it in a painless method. The traditional kyphoplasty uses a balloon to create the bone void. The system I use relies on a mechanical tamp that allows a safer, more controlled creation of the bone void and allows me to put the cement in the fractured bone in a very safe manner. In most cases, I'm able to put in less cement in a very safe manner compared to the traditional kyphoplasty. If you're suffering from the symptoms of spinal compression fractures, such as continuous pain that just is not healing up on its own, please feel free to come by our office and be evaluated.